I'm here because we've got a lot to share. I'm here because we do the same thing. And I know that's startling, so let me explain it. Let me give you a definition of what you do in healthcare. And this doesn't change whether you're an administrator, whether you're a CEO, whether you're a nurse, a doctor, whatever your role in healthcare. And you tell me, somebody raise a hand and tell me if you don't agree with this definition. But you are, and everybody in healthcare is, highly trained, highly motivated professional, working in a real-time, high-pressure environment, using very expensive implements and tools, in an environment in which the penalties for failing, the penalties for making a mistake are very great in both human and in monetary terms. Anybody disagree with that? Okay, now, by contrast, let me identify to you, let me give you the definition of an air crew, or for that matter, the CEO of an airline, or the chief pilot of an airline, or a flight attendant, or a dispatcher. They are highly motivated, highly trained professionals working in a real-time, high-pressure environment, using very sophisticated implements and tools, very expensive ones too. Boeing doesn't give away those airplanes. In an environment in which the penalties for failing, the penalties for making a human mistake are very great in both human and in monetary terms. In other words, it's the same definition. We do the same thing. Oh, there are some differences, of course. I don't mean to represent to you that the simplicity of an airline cockpit is exactly the same as an operating room or an ICU. Quite frankly, they're not. They're completely different. You've got much more of a subjective environment. I understand that. But the human elements, the human dynamics of communication, the ability to transfer information from those who have it to those who need it, the blockages to the communication, the problems of identifying where difficulties arise that create accidents, all those are shared. We do the same thing. We're both operating at the sharp end of a very complex system. We are both communities, healthcare and aviation, engaged in something that requires a tremendous amount of public trust. And inevitably, we both are inextricably intertwined with the use on a continuous basis of the carbon-based unit. All right, that's a Star Trek term. I need a covenant from you here. I'm going to take you into some more cockpits. But I really don't want you to think of these people as pilots and co-pilots and flight engineers. Think of them, please, as the folks you work with. Think of them as healthcare professionals, because these are human lessons. And what you're going to see here and hear me talk about are interactions that could occur in an OR, an ICU, an ER, a clinician environment. They're that phone call at 3 a.m. in the morning, the 6th time it's occurred this month, to the OBGYN who's getting tired of being awakened and says to himself it's a false alarm and ends up with a patient going sour. It's the same sort of problem when a doctor has turned to a nurse and said, damn it, stop interrupting. It's the same sort of problem when somebody stands at the back of the operating room and says, hey, I told him, I don't need to say any more. I've put my 2 bits in. I'm not going to get snapped at again. We have a little different paradigms, by the way. For those of you who have experience in the Army and the Navy, we're definitely different in the Air Force from Navy flyers. Probably the principal element of difference is that Air Force guys like their airfields to remain precisely where we left them. We get very upset if they start moving around on us. Here was Barry Klein, Major Barry Klein, the guy in the United States Air Force least likely to ever make a gear-up landing again. And what's our solution? We're going to make sure that he never has that opportunity. We're going to take his wings away from him. We just paid $1 million, $1.5 million to train this guy never to do it again. But that was our methodology. Dallas, a number of years ago, 727 taxis out for takeoff, flown by Delta. You know Delta, the airline that originated the phrase, I don't know where I'm going to go when I die, but I know I'll connect through Atlanta. I love to pick on Delta. What we had to do in aviation was realize that all these blockages were crashing airplanes and killing people. We had to do something. And it wasn't just in aviation. As I say, you know it's in healthcare as well. There was a situation involving an engineer, a design engineer, in a company that designs big ovens. A friend of mine by the name of John Young was with Nabisco. And they were getting ready to open a new line. It was going to make cheese puffs. And this line was up in Toronto, Canada. And on the day that they turned the ovens on, The Baker in all his finery, a big tall hat on, was going to walk down and look at the little inspection windows. And he begins to act strange between inspection windows 5 and 6 because, as he says, there are no cheese puffs. Now, I got to go back 6 months to the design phase in which a young engineer came up to the chief engineer for one time too many that week and said, "Sir, I want to check the specifications for this particular." "Damn it, I have told you, read the specifications and design them and leave me alone." "Okay, sir, I'm sorry, didn't mean to bother you." He goes back to his station and designs in the standard electric motor. Now we're 6 months later. It's a nice rainy night in Toronto. There's a freeway alongside the factory, and my friend John Young is breaking away from a group of executives to go over and ask Henri, the baker, "What do you mean there are no cheese puffs?" He says, "There are cheese puffs here, but there are none here." About that moment, somebody comes running in from outside. There's a clang of a heavy metal door. "Stop the ovens! It's raining cheese puffs all over Toronto." Instead of a 0.5 horsepower standard motor, they put a standard electric 50 horsepower motor, and the exhaust fan is sucking all these greasy little puffballs up. There's a freeway next to the building. There is an orange blizzard on this freeway. Cars are spinning out. Sirens are going everywhere. All because an otherwise kinder, gentler commander made one principal mistake. So he's the sort of individual that people can approach. They can talk to. "Oh, he's an old-style captain, all right. He's a James Kirk." That's what all of us were taught to be. He's in command. He knows what everybody should do. He knows where they should go. And he is spoken to only with respect. And he runs his cockpit in the same tradition of Dutch mariner excellence that's been around for hundreds and hundreds of years. But Jacob, this particular day, is a very upset guy. The reason he's upset is because he's had to divert into a place he didn't want to go. See, the chief pilot has to fly every now and then, just like the director of the medical staff has to stay current. And he's gotten out and gone in a 747, and he's taken this charter down to the Canary Islands, and he's going to turn around, pick up another group of passengers, take them back to Amsterdam, then he'll get off, go back to the office, and somebody else will fly the airplane on. Except it's not working that way. Murphy has gotten in the works. And there's been a bomb threat over at Las Palmas, which is the main airport of the Canary Islands, so he's had to divert, along with several other airplanes, to another airfield at slightly higher altitude, only one runway, it's kind of short, and it's fog-bound today. It's not really fog, it's clouds blowing across the runway, but it's just the same. He's had trouble getting his fuel. He's had trouble getting out of there, and he's about to run out of a thing we call crew duty time. This is the maximum amount of time that an air crew may remain on duty before we've got to put them to bed to get them some rest. I know this is a completely foreign concept to healthcare. By the way, we've got to make this not be a foreign concept to healthcare because it's physiologically. Let me tell you how it worked when we changed the culture. And that's what I'm talking about, is changing the culture. And make no mistake about it, when I'm talking about healthcare and applying these things, we're not talking about Band-Aids. We're not talking about fixes. We're not talking about adjustments. We are talking about taking a massive, amazing culture of very effective, highly trained, highly motivated people and changing that culture like changing the course of a huge ocean liner. And it is not going to be easy. You will be measured by how well you can orchestrate all the human talent entrusted to you. And if you don't maintain an atmosphere in which that first officer and that second officer, if you have one, can instantly and effectively communicate anything that needs to be said, then you can go fly for Delta because you're not welcome here. Sorry, I got to pick on Delta. They've actually got religion. They were slow on CRM, but they finally came on about 1989, and they're doing a good job of it, a great job of it today. But we also turned to the co-pilot and said, Mr. Co-pilot, or Mr. Second Officer, or Ms. Second Officer, or Ms. Co-pilot, if you are not ready, willing, able to jump in and say, with respect, what needs to be said instantaneously, we don't want you here, because you are co-equally responsible for this airplane. Forget sitting back there and being afraid to offend a senior individual. This is your job. If the culture had not changed and the least among them had not been not only entitled to, but directed to participate in that decision, they managed to get it all the way to Honolulu. They had one chance at final approach, and they made it. Of course, we're such creatures of habit. On short final approach, the first officer, trying to make sure he hadn't forgotten anything, turns around and he's got a hole as big as Kansas in the side of the airplane, remember? He says, "Are we depressurized?" Yeah, I think so, but I'll work on it, you know. The news is, the good news, there are ways to do this and there are ways to do it with great effectiveness, and it is very surprising because in changing a culture you start from the position of saying, how in the world can we ever effect a change? And I'm here to tell you as a veteran of a massive change in a very staid industry that it's not only possible and probable, but it is highly achievable.